So how do plastic surgeons create a tummy tuck? All right, so imagine this is your abdomen here. It's all the wrinkly skin of the belly. You got your head up here, breasts are right here, pubic area is down here. So the first thing we do is we have to make our incision underneath that pubic area line. And then we use our tools to basically dissect and separate the skin from the underlying tissues. And we go all the way to the top where your rib cage is up here. These are your six-pack muscles and your belly button hidden underneath there. So in a lot of women that have had babies or a lot of weight loss, they have separation of the six-pack muscles, and the six-pack muscles need to be near each other. So we use a suture to suture those back together again. And so I'm just gonna kind of push them together here. But basically we want those guys touching. And when they're touching, we know that we're in good shape there. And then we pull that skin down nice and tight, and we pull all that excess down. And we know that, like, okay, there's all this excess at the bottom and we have to make our incisions. So then we go right at basically the bottom of the six-pack muscles. We cut across. Cool. All right, awesome. We get rid of that extra skin. And then we need to bring that belly button out. So we, believe it or not, we actually look underneath and we're like, okay, where's that belly button sitting out? Put our finger underneath, feel where it's coming out of the skin, and make our little incision so we can make room for that belly button to come out. And every surgeon does this a little bit differently, but basically you're just trying to make a small little hole. Once you've moved that skin, you need to make your hole for that belly button to be able to kind of poke its way through there, okay? Now in some people, the only other thing that changes is that if you don't have a lot of skin to be able to pull all of this all the way down, you may end up with that belly button hole pulled down, and you may have a little vertical cut right there that we suture together, and usually heals pretty good, but that's why you'll see in some people that there may be a little vertical as well as that horizontal one, because the belly button is either really high, there's not enough to be able to pull things down. And you got a smooth belly, low incision, belly button poking out, and we actually, with our lipo, we'll do a little bit of midline and ab contouring to help those abs to pop a little bit more, and that's how you